Well, there's no doubt been excess deaths during the past 3 years of the pandemic. Beginning in 2020, then 2021 and 2022, the overall sheer number of people who have died has exceeded the expected number. Now, I've covered this several times on my show. The number of excess deaths they give us is on its face inaccurate because when they estimate how many should die each year, they base that number off of an average of the past 5 prior years, which doesn't take into consideration population increase or aging boomers, for example. However, even though the number is not accurate, for example, they claimed the deaths in 2020 were around 550,000 excess, when the actual number, when you go back and account for population increase and aging boomers, is more likely around 350,000 here in the United States. The fact remains there were 350,000 more people who died than should have in 2020. And that goes for every year after since the pandemic. Now, why is that? Well, most would say the virus, obviously. But our next guest says that's not the case. With us now is Nick Hudson, chairman of Pandata. Now, that stands for Pandemics, Data, and Analytics. Pandata is an organization that, you guessed it, analyzes pandemic data. Nick, welcome to the show.
Thank you very much, Kim, and thank you so much for your incredibly courageous stand in this whole saga.
Thank you. I've just been following the science. People always ask me, how has it felt? What have you, when you were facing all this pressure with people around you? And I always just said, as long as you follow the science, as long as you follow the actual data, it wasn't a difficult stance to take, right? I mean, it was either that or lie. And I couldn't lie. I couldn't ignore the actual data, and neither can you. That is why you're here with us today, talking to us about the excess deaths. And this is a question I've had. I'm glad you're here, because even though I've been able to look at the excess number of deaths and say, okay, their number isn't exactly accurate. We've got to count for all of these things. Once you do the math and calculate it out, it goes from, like I mentioned, in 2020, 550,000 or 650,000, whatever they were claiming, down to about 330 or 350,000. However, that being said, I couldn't figure out exactly why those 330 or 350,000 extra people died. That's just in the United States. I know we're talking worldwide, but I haven't been able to exactly pinpoint why. I assume some from the virus for sure, but a lot of those deaths, when you analyze them, they're younger, or there's a lot of questions. Did people die from drug overdoses for whatever reason? Alzheimer's deaths seem to be higher for some reason. Car crashes, surprisingly, were higher in 2020. So I couldn't quite put my finger on it. So I'm glad you're here to explain more of this data. Where did these excess deaths really come from?
Well, Kim, what I like to do as a bit of a thought experiment is to ask people to imagine that there was no virus. I ask them to think about how they would feel if one day the leader of their public health system appeared on the television telling everybody that what they should do is tell sick people to go away until they turn blue, and to isolate and drive a narrative of fear into the hearts of elderly people, to basically eschew the use of antibiotics when it comes to treating people infected with pneumonias, and to otherwise indulge in all manner of public health interventions that had never been contemplated before. And most people who I propose that thought experiment to have no problem whatsoever in telling me that if that public health leader had indeed appeared on television suggesting that strategy in the absence of a virus, there would have been riots on the street. People would have said, thousands will die. Yet that is what we did, not just in the USA, but around the world. We embarked on a program of extraordinary, absolutely extraordinary public health interventions that in normal times we would predict without any sense of doubt would result in waves of mortality.
So you're saying that, I mean, that makes perfect sense, that of course the measures themselves, the pandemic, lockdowns, I agree with you completely. One thing that made me very angry was when my father in his 70s got COVID, and I went to go care for him. And it did make me think about all of those people who were older who got sick, and no one in their families felt like they could go in there to help them, right? They were told, oh, you go in
Yeah.
there, you might die. And so people
Yeah.
stayed away. They stayed away from their loved ones. When you get the flu, you need fluids. You need somebody to check your temperature. You need somebody to keep that temperature down, to make sure you're taking, especially if you're older, your daily regular medications that you need for whatever you've got going on. So, of course, people would be holed up, as you mentioned, until they turned blue. Nobody there to help them out. And that angered me. I really did feel like there were a lot of people who probably died just from a sheer lack of help, because all the government said to us was lock down, wear your mask, get your vaccine. And then it was like, okay, did all that, still got COVID, lots of people. And then they didn't give us anything. They gave us no tools for once you got COVID. I mean, there were groups out there that said, here's some things you can do. Take, ivermectin or lots of vitamin D or whatever it is. There were some groups that were trying, but otherwise the government just said, nope, you stay away and don't let anyone near you, because now you're infectious and you're going to get everybody else sick and they're all going to die too. I mean, that was absolutely the narrative. And I do think that killed a lot of people. But how many people do you think that actually killed in
Well,
the
before we get on to
excess?
how many people, I mean, before we get on to how many people, I don't think the process is very complicated. Most people have it as an intuition that if you take a frail, elderly, vulnerable person and you turn them into an isolated and fearful person in addition, they will very soon become an isolated, fearful, and dying person. We know, if we consult our basic virtues, our sense of character and courage, that the thing to do with an old person is to accompany them continually, to reassure them, to be kind, to touch them. And these are the very things that were prohibited. How many people died as a result of these interventions as opposed to from the virus itself? That is an answer I would really be reluctant to spout out. We're not sure, and we will remain unsure, possibly forever. But my very strong intuition, based on the reams of data we've looked at and the mechanisms of action, is that the majority of deaths in the COVID epidemic were caused not by the virus, but by the pandemic response itself.
Yeah, I mean, I'm certain that there were some people that did die from the virus. I do think that it's a blood virus. It affects people's blood. It gives them blood clots, heart attacks. We know, I would say this because we know that the vaccines do this, and the vaccines are like an amped up version, right, of the virus itself. So I would think that there were some people that did. I just don't know if the number, when we look at the United States, if that number, that 350, I would love to know how many of them really died from COVID versus from the treatment itself in the hospitals, for example. They were in the beginning were bringing people in and putting them on ventilators and giving them then remdesivir. And I think all of that we now know was not the right choice, and not to the fault of the healthcare workers. They were doing their best. They didn't know. And I think in a lot of these novel sort of even the influenzas that come out and Ebola and stuff, a lot of times the treatment unfortunately ends up killing people more than the virus itself, because the healthcare workers don't know what to do and they're just kind of trying things, and then they find out, ooh, so that wasn't exactly the best approach for this. But definitely a lot of the deaths seem to have been from a variety of other things and not from the actual virus itself. Do you think what is your thought? Do you think that anyone died from the virus?
Yes, of course. But I would like to use an example from my home country. I live in South Africa, and we have a doctor here by the name of Shankara Chetty, for whom the medicines that you mentioned earlier, ivermectin and hydroxychloroquine, were not available. And he treated something like 14,000 patients without a single death. Now, how is that possible?
Yeah.
He treated, first of all, the patient in front of him. He proceeded like a normal doctor would when somebody sick walked into his presence. But I think beyond that, he treated people with compassion and he prevented them from becoming fearful. He was a reassuring force in their lives. And his results speak for themselves. So as I know there are a lot of doctors out there who like to believe that the compound that they used was a magic bullet and that none of this would have been necessary if everybody had used their particular flavor of magic bullet. But I think the simple reality is that none of this would have been necessary if everybody hadn't panicked.
Panic certainly kills, certainly does. Were there certain aspects of the response in particular that you think were more harmful than others? Were there some that maybe in the
Yes, I think
future, if they were to do it again, it wouldn't be so bad, but others were like, okay, don't ever do that particular thing again?
yeah, I mean, the first one that comes to mind is the almost, well, definitely willful projection of fear. I think what you want in the face of any disaster is courageous people. I mean, if we were having an earthquake, you wouldn't ask everybody to go and, run away from the scene of the disaster. You want somebody running in and helping the injured. We've forgotten courage as a virtue. And so I would say, certainly, without any doubt in my mind, that the encouragement of fear is the very worst possible policy that you would endorse. But I think also beyond that, it's the case that we should take the priority should be that we should inform people correctly and acknowledge the complexity of the situation. There's never any severe problem in life, any crisis, that is not a manifestation of complexity in the world. And the way we deal with complexity is to entertain multiple suggestions, multiple conjectures as to what to do with it. And we have had exactly the opposite. We have tried throughout the world to adopt one-size-fits-all policies, unutilized in prior crises, untested. Very often the invention of some mad scientist with a spreadsheet, and then impose those all over the world. And when somebody has said, look, this is not working, the response has been to censor them, to ban them from social media, to call them names. And I think that, given enough time, I could probably persuade myself that was even worse than the fear, because the fear itself is a problem. And given enough people working on the solution with enough alternatives as to how to solve the fear, we probably would have come up with something. But the one-size-fits-all kind of approach basically destroyed the mechanism of error correction and left us with this very drastic situation where we had absolutely horrific policies being implemented and all the protesters against them being silenced.
Well, there's certainly, I mean, what you're saying absolutely makes sense, and it seems to be supported by the data. In fact, what's really interesting is that the one country that was demonized for not locking down, right, Sweden. So when everybody looked at Sweden, they said, oh my gosh, we saw on the news over and over, how dare they not lock down? What are they doing, giving their population choice on how to protect the elderly and going on with life as normal? It turns out now in hindsight, and this is the data from March of 2020 to June of 2022. Out of all the countries, including, now everybody always compared Sweden to Norway, Denmark, right? All of their counterparts that had, because Sweden did see more of a spike in the spread of the virus and in deaths than their neighbors, Norway and Denmark. But for other reasons, Sweden has actual nursing homes. Denmark doesn't really have those. It's a more populous country, more dense. Nonetheless, in the end, when it comes to excess deaths, the topic we're talking about, Sweden beat out all the other countries in Europe as the lowest for excess deaths for the nation, beating out even Norway and Denmark. In fact, Sweden had the number that they're using, the cumulative excess death percent for Sweden was 6.7, Norway 6.9, Denmark 12.9. Iceland, even, which I thought did a really great job during the pandemic. They didn't lock everybody down. They did isolate their island. Um, but it's an island. It's tough, right? I mean, it spreads when it gets there. 16.8. It goes all the way. You get down to um, the United States is at the bottom of this list at 54.1. That is a massive
Mm.
difference than Sweden's 6.7, 54.1. Even Australia, 18. That's also a lot higher than Sweden's excess death. So, it does look like Sweden wins in the end. I mean, people were demonizing them for being the country that went in that direction. And in the end, they did end up. And even, there's mainstream news organizations reporting on that. So showing that, okay, Sweden ended up not having so many excess deaths. There's Reuters. Sweden saw lower 2020 death spike than much of Europe. Even Reuters going in on that. So, yeah, you're probably
Kim,
right that the data is showing it's the lockdowns that did it.
Kim, let's step away from the numbers. It's often pointed out that it takes one black swan to prove that not all swans are white. And what we have seen in numerous regions or countries is that at the end of 2020, there were countries that had negligible excess deaths, despite most of their populations having been infected. And those infections were measured in robust scientific ways using seropositivity studies. So we can see that there were places in the world where the majority of the population was infected, and yet there were negligible excess deaths. And that little counterexample should surely cause us to doubt the narrative that we were dealing with a novel deadly virus, and that if we didn't lock down and hide behind our masks, we would all surely die, because those people did get infected. Whatever they
Yeah.
did, whatever they didn't do, ended up in the situation of them being, for the majority, infected. And yet they didn't experience excess mortality. And that should cause us all to pause and think, and to wonder whether the countries that did experience excess mortality weren't actually victims of some other cause. And that's when we begin to look at things through the statistical microscope, and we begin to consider the other factors that are at play. Not only that, we begin to look for the statistical signals that would suggest to us that there was some kind of viral spread happening in a population. And in some very interesting cases where we have data that is of sufficiently high resolution, we can see that the viral signal is completely absent. And the case of Italy is a case to point. We know that this was the first country that locked down after China, and we were all confronted on a daily basis, our televisions being full of the deadly saga that was unfolding in northern Italy. Yet when you break down that data at a provincial level, what you find is that there's no sign whatsoever of that viral spread, and that the deaths are more closely associated with which province a municipality falls. And we see, instead of there being a signal for something, can you imagine if I throw a stone into a pond, I would imagine some ripples would emanate from the point at which the stone landed. We would expect to see that kind of signal from a viral outbreak, and we do not see it. We see instead that the pattern of deaths follows political lines. And then you begin to wonder whether policy isn't more to blame for the question of why people died where they did. So there are many signs such as this that suggest that there's something going on other than the spread of a novel deadly pathogen. And that, I think, is a kind of story that's going to unfold over the ensuing years. And I'm pretty convinced, after seeing the data that I've seen, that the adjudication of the case will be that the public health people made a blunder in deciding to propagandize this virus, in deciding to spread a narrative of fear.
Yeah, I think there might be something really to that maybe scientists could take a look at is when you have two people who are sick and one is afraid and one is not, who is more likely to survive? And it could be that fear. And we know that will is an important part of survival, that attitude and what that stuff kind of gets pushed aside often, like, oh, it's not that, it's all just about the actual medications and the ailment, and there's a lot about how
Yeah,
you're feeling that helps you survive or not, and that very well could have been it. You're right, it could be the
absolutely.
fear that actually caused the deaths. Very fascinating,
Yeah, for
something
sure.
for
And you
sure.
know what? Every man in the street has heard of a placebo. We invented the concept of randomized controlled trials in part to deal with the problem that there was a placebo effect. If you gave somebody a little white tablet and told them this will make you better, even if that tablet was just made out of sugar water, you would find that a lot of the people in your study experienced remarkable recoveries from whatever disease they had. There's an opposite effect from the placebo effect called a nocebo effect. It's otherwise known in the medical literature as morbid dread. And that's the effect of telling somebody that they're sick when they aren't. People will die. Witch doctors in West Africa telling people that they've got something wrong, some kind of curse, some kind of hex has been cast upon them, have been known to die from this sense of morbid dread. And that's an exaggerated sense of the story, but not by much, not by much at all. If you tell
Yeah,
people there's something to fear, it will have a negative impact on them. And that's
yeah.
definitely one of the factors at play here.
I think you're right about that. I do. I mean, I've never thought about that, the opposite of the placebo for sure, but makes a lot of sense. So, Nick, thank you so much for joining us. Nick Hudson, chairman of Pandata. Thank you for being here.
Thank you very much, Kim.
All right, guys. So Birch Gold is doing this really cool thing this month. For qualifying purchases, they are going to send a free safe directly to your door. I think it has to do with my birthday because this is my birthday month. And so maybe they're just giving out birthday presents on my behalf. It's a nice thought. It's not what's happening, but my birthday is on the 28th of this month. But this deal goes all the way until the 31st of the month. Again, qualifying purchases through Birch Gold, you could get a free safe shipped directly to your door. All you have to do is go to birchgold.com/Kim and get your free info kit. You can then talk to a specialist. That specialist will walk you through what you need to do. Maybe you want to buy real gold and silver and other precious metals that you want to store in that safe, or maybe you want to convert your existing 401k or IRA. I always get this, it's a tongue twister. Your existing IRA into an IRA in precious metals. Either way you want to do it, that specialist will walk you through it. Just go to birchgold.com/Kim and hopefully maybe you'll qualify for one of those free safes sent directly to your door. That's birchgold.com/Kim.